Hello, and welcome to September's Wellness Moment on cold and flu prevention. Today, we're going to be talking about healthy habits to help you prevent the cold and flu, some fast facts about the flu vaccine, and how to tell whether or not you have the cold or flu, and when you should start seeing your healthcare provider versus being able to try to manage it at home. So our goal for today is to help you stay healthy throughout the cold and flu season by practicing healthy habits that help stop the spread of germs and prevent respiratory illnesses. The cold and flu can happen year-round, but cold and flu viruses are most common during the fall and the winter. So we're starting to enter into that cold and flu season. Flu activity in the United States usually increases between December and February, and the health impacts of the flu can include infections, hospitalizations, and even death from some of the different infection complications from the cold and flu. So here are some helpful tips to help you prevent the cold and flu this season. Avoid close contact with people who are sick. And if you're sick, try to stay home to avoid spreading the illness to others. If you have a cough or if you're sneezing, make sure you cover your mouth. Respiratory illnesses like the cold and flu are spread through cough, like sneezing, and unclean hands. So make sure you keep your hands clean and wash them often with soap and water. If they're not available, you can use hand sanitizers or other alcohol-based hand rubs. Avoid touching your eyes, nose, and mouth with your hands, and clean and disinfect surfaces at home, work, and school. Make sure that if you're preparing or doing anything on a surface that you clean that surface. And make sure you're practicing other healthy habits such as eating a healthy diet, being physically active, managing your stress, and getting enough sleep. Each of these areas helps protect your immune system. Healthy foods, getting all of your nutrients in, that helps build up your immune system and keep your immune system strong. Physical activity helps improve your immune system as well. High levels of stress can reduce your immune system and make you more prone to get infections. And not getting enough sleep can make you more prone to infections as well. One of the best things that you can do to help prevent yourself from getting the flu is get the flu vaccine. It reduces the risk of flu illnesses, hospitalizations, and flu-related deaths in children. The flu vaccine protects against 3 or 4 viruses that researchers suggest are the most common flu strains for that year. The flu vaccine helps your body develop antibodies to fight the flu virus if you should happen to come in contact with it. It takes about 2 to 3 weeks for the vaccine to become effective, so the CDC recommends everyone 6 months and older get the flu vaccine. For some people, the vaccine is not recommended if you have certain health conditions or allergies. So talk to your healthcare provider if you have any questions about the vaccine. It is best to get the vaccine before the virus begins spreading, since it does take about 2 weeks for the antibodies to develop in the body. According to the CDC, the best time to get vaccinated is by the end of October. It can still be beneficial, though, to get the vaccine later in the flu season, even into January. The flu and the common cold are both respiratory illnesses, but they are caused by different viruses. Symptoms of the cold and flu are very similar, although colds are usually milder and flu symptoms are more intense and abrupt. Colds generally do not lead to serious health problems like the flu can. Symptoms of the flu include fevers and chills, a cough, a sore throat, runny or stuffy nose, muscle and body aches, headaches, and fatigue. The cold symptoms are similar, but usually come on more gradually and are milder. Not everyone who has the flu will have a fever, though. So when should you see a healthcare provider? Well, if you are having symptoms of the flu and are either over the age of 65, pregnant, or have certain medical conditions, you should contact your healthcare provider. If your children are having symptoms of the flu, you should also contact your provider. Lab tests can be done with your healthcare provider to determine whether or not you have the flu. For adults, you should also seek medical attention if you have a fever over 101.3 degrees Fahrenheit, have a fever lasting 5 days or more, or have a fever return after not having a fever for a while, or have shortness of breath, wheezing, a severe sore throat, headaches, or sinus issues. If your child has any of the following, you should make sure you see your child's medical provider. A fever of 100.4 degrees Fahrenheit in newborns and up to 12 weeks. In any child, a rising fever or a fever lasting more than 2 days. Symptoms not improving or worsening in children, or wheezing, ear pain, fussiness, drowsiness, a lack of appetite, a headache, or a cough. If you or your child have the flu, your healthcare provider may prescribe antiviral drugs to lessen symptoms or prevent serious complications that could require hospitalization. If you have any other questions on cold and flu prevention or treatment, please make an appointment with your Everside Health clinician or your own primary care provider to ask how you can better protect you and your family from the cold and flu this season. Here are hours of operation for the City of Dayton's offsite clinic. And just a note, on Thursdays, we are now open from 7:30 a.m. to 7 p.m. If you have any questions, please email me at sarah.wiseman@healthstetinc.com.